WeSpark Igniting Discovery grants are grants that provide some seed money to researchers who have a great idea to move the field forward. And the fields that I'm talking about are spanning a wide range of different disciplines and a lot of different health problems that affect the people right here in Windsor, Essex. We are sponsoring researchers from all different career stages, and really these are in many ways igniting new research programs, new ideas, bringing new teams together that can transform the health landscape right here in Windsor, Essex. Tackling our biggest health challenges requires a thriving research environment, and that involves all of us. So thank you so much to our sponsors and to our donors, and congratulations to our recipients. We look forward to all that you will accomplish.
Initially, NYN began working with WeSpark Health Institute to design and launch their website. As a local company, we are invested in the health of our community and saw sponsoring a research grant as a unique opportunity to get involved. We'd like to give a big thank you to everyone who is facing the pandemic head on. We're pleased to be a sponsor of the WeSpark Ignite Discovery Grant, and we'd like to congratulate all the grant recipients and thank you to all those involved.
One of the positive things that I think has come out of this pandemic, not only in our corner of the world in Windsor, but if you look globally and worldwide, is a sense of collaboration, of people working together, people supporting each other to fight a very common enemy. And I think that's one of the positives that has helped us in Windsor, Essex area. So one of the things that we wanted to do was to break down some of the silos that we have had previously and bring our hospitals and our strengths and our differences together to work together. So when Dr. Moncour from Erie Shores, Dr. Saad from Windsor Regional, and myself, we all have very different strengths in our own hospitals. And I think that's one of the best things about this research project of looking at people who have had COVID-19, and especially what we're identifying as these long haulers, is that we can look at them in different ways from our own lenses, and we have different strengths to be able to help them. So I think, again, that the sense of collaboration, the sense of speaking to each other, the sense of working together is really positive, because that's where you get your best ideas, is when you talk to someone that's looking at it in a different light. So I think that is one of the strengths of this collaborative effort. And the other thing that has been so great about this is the fact that we have a local support in the corporation, the company of NYN, who has felt that this is important enough to support their own community in looking at how this has affected us and how we can move forward in a better way to help our own citizens. So those are some of the positives that I guess I'm taking out of what's been a very difficult situation throughout this pandemic.
One of the many things that this COVID pandemic has done, if you want to look at the bright side, is advance the academic and research vision of our local hospitals and our community. We recognize that COVID-19 obviously affects everybody across the globe, but what people in Windsor, Essex are no different. We've been noticing over the last several months a lot of patients experiencing what we call long haul symptoms. And I was in various meetings with my fellow chiefs of staff from Erie Shores Healthcare, Dr. Moncour, and from Hotel du Grace Healthcare, Dr. Steen. And that we thought, this would be a great collaborative effort if the three of us could get together, create a registry of patients that have been affected by COVID-19, and then see what their long haul symptoms are, and see if we can try to do some research around what are some of the contributing factors that led to them developing these long haul symptoms. We know this research is not unique to just Windsor, Essex. We know this is being done across the globe, but we would like to contribute to that international database to see if we can help by identifying what are some of the factors that lead to long haul symptoms, and maybe even be able to identify certain treatment options for patients to get them recovered, help them with their post-discharge from hospital, on their way out of the acute care hospitals over to the rehab facilities or even home. So this has been a great collaborative effort. Obviously, we would not be able to do this research without funding, and that's where WeSpark comes in. WeSpark, was created for this particular purpose. It makes it very easy for people who are interested in research to be able to go to one central location and get their idea off the ground, and then they act as a central coordinator to link them with potential funders for the research projects. We are very grateful for local funders like NYN that stepped up for this particular grant. And I think it's going to go a long way to contributing to the medical database and the knowledge for not just Windsor-Essex, but for the global community. So again, this project would not have gotten off the ground if it wasn't for WeSpark and if it wasn't for the local support that we've received. So we're very grateful for both those.